Men over 60, I urge you to pay attention to the following. The actions you take or avoid when you're alone in your bedroom can directly affect how long and how well you live. Moreover, this concerns not only the number of years but the way you spend them. Last week, a gentleman named Alfredo, age 70, came to see me. In silence, he entered, slowly lowered himself into a chair, and looked at me with that familiar gaze full of doubt and awkwardness. "Doctor, there's something I've wanted to ask, but have never told anyone," he began, nervously adjusting his hands as if he couldn't find the right words. At that moment, I already understood what he was about to share. It's a subject that worries countless men but is rarely brought up, one many avoid because of shame, fear, or simply lack of knowledge. I am Dr. Eduardo Vasconcelos. For more than 30 years, I have dedicated myself to men's health. And today we will speak seriously, without detours, without taboos, without sentimentality, as if we were face to face, just the two of us in a doctor's office. Because the truth about your prostate and how often you ejaculate is far more important and surprising than you might imagine. This small walnut-sized gland under the bladder may seem harmless until the day it becomes a problem. Science is revealing deeper truths. The way you approach your sex life may be one of the key factors determining whether you live to be a healthy centenarian or face an oncological disease already in your 60s. What's most surprising is that this connection may be tied to something simple: the regularity of your ejaculation. Yes, exactly. And there's no need for embarrassment. This is about medicine, physiology, and prevention. My words left Senor Alfredo speechless. I will give you the same explanation I gave him. But first, I want to draw your attention to one important fact that should not be overlooked. Prostate cancer is no longer a distant fear. It is a real and increasingly pressing threat for men over 60. A study published in The Lancet predicts that by 2040, the number of diagnosed prostate cancer cases will double. We will go from 100,000 cases a year to nearly 3 million men receiving this diagnosis annually. The number of deaths is also expected to rise, reaching 700,000 a year if nothing is done. This means that thousands of men like you, fathers, grandfathers, husbands, are dying from a disease that could be prevented or controlled if there were more information and less shame about talking about our bodies. And here we come to the central point of our conversation. The frequency of your ejaculation can directly affect your prostate health. No, this is not an exaggeration or mere conjecture, but a real physiological factor supported by numerous serious studies, about which most men, unfortunately, have no idea. Imagine the prostate as a small yet vital factory, quietly and tirelessly working every day of your life. Hidden beneath the bladder, it performs a key function, producing a thick, clear fluid rich in zinc, citric acid, and special enzymes. This fluid plays a vital role in protecting and transporting sperm. But this factory does not work alone. The seminal vesicles produce fluid rich in fructose, an energy source for sperm. The testicles contribute only about 1% of total volume, but carry what matters most: the sperm cells themselves. All of this comes together in a true feat of engineering in the male body. At the moment of ejaculation, a complex, finely tuned sequence unfolds. First, all the fluids accumulate in the urethra, waiting to be released. Then powerful contractions of the pelvic floor muscles propel the semen outward. This process is impossible without sensitive nerves, well-developed musculature, and precise coordination among the brain, hormones, and reproductive system. And this is where an important point arises that many do not consider. When this factory runs regularly, everything functions properly. But when it sits idle too long, the system begins to suffer, build up pressure, hidden inflammation. The body is not designed for stagnation, especially when it comes to the prostate. Now consider what happens to a river when the water stops flowing. It collects, turns murky, stagnates, and gradually begins to rot. Something similar can happen with your prostate if you go too long without ejaculating. Men who ejaculate infrequently, whether due to age, illness, medication, or the shame of discussing it, can develop a condition known as chronic prostatic congestion. This congestion creates internal pressure in the gland that can lead to a feeling of heaviness in the pelvis, discomfort during urination, constant irritation, and in more severe cases, chronic inflammation of the prostate, or prostatitis. Don't take my word for it. Researchers writing in the Journal of Urology in 1999 studied men with chronic prostatitis and found that participants who began ejaculating more often, whether through intercourse or masturbation, experienced significant symptom improvement over several months. The explanation is simple. Ejaculation helps empty the prostate ducts, reduce inflammation, remove accumulated residues, and relieve local tension. Ejaculation can be viewed as a physiological cleansing system that supports prostate health, and prolonged downtime of this system raises risks. What happens in a man's body after ejaculation goes far beyond physical pleasure. Studies show that male orgasm triggers a powerful release of neurochemicals. For example, prolactin, which reduces arousal and promotes relaxation. Oxytocin, the bonding hormone, which induces feelings of safety and calm, and endorphins, natural painkillers that help manage stress and support deep sleep. A study published in 2023 in the journal Sleep Disorders found that men with an active sex life are less likely to experience trouble falling asleep, wake less at night, and report deeper, more restorative sleep. Regular ejaculation benefits not only the prostate but also serves as a natural sleep aid, a priceless tool available to everyone without extra cost, side effects, or drugs. Men who ignore their sex life risk not only congestive processes in the prostate, but also deprive themselves of a powerful natural means of combating stress, anxiety, and insomnia. This question worries many men, yet it rarely gets a clear, comprehensive answer. Is there a link between frequent ejaculation and reduced risk of prostate cancer? The answer is yes, and strong scientific evidence supports it. One of the largest studies in this field, conducted by American scientists over 18 years, confirmed this hypothesis. More than 30,000 healthy men participated, and researchers analyzed their sexual behavior, lifestyle, and prostate status. The results were compelling. In men who ejaculated 21 times per month or more, the risk of developing prostate cancer was significantly lower, by 33%, compared with those whose sexual activity ranged from 4 to 7 times. The risk dropped by 33%. This is not trivial. It's a substantial reduction achieved simply by maintaining regularity. Most interestingly, whether this happened with a partner or alone, the protective effect was linked directly to the body's physiological processes during the act. Subsequent studies have confirmed these findings, and publications in recent years point to the same conclusion. A healthy prostate is one that works regularly. This isn't just talk. Often the human body needs movement, steady flow, and consistency. Stagnation inevitably leads to disease, while activity strengthens health. But how does frequent ejaculation protect the prostate? What is the secret of this simple, natural act familiar to every man, yet still mysterious to many? It's important to understand that the prostate is not made for idleness. This gland, located just below the bladder, produces a thick, nourishing fluid that is a major component of semen. This fluid must be continuously renewed and circulated. Stagnation leads to negative consequences, just as standing water in a reservoir becomes old, contaminated, and saturated with waste. This is the essence of the cleansing theory. Each ejaculation is a natural emptying process. Substances expelled during ejaculation help reduce inflammation and lower internal pressure on the prostate. In the absence of such outflow, the risk of chronic inflammation rises, which in turn increases the likelihood of cellular mutations that can progress to a tumor. But that's only one side of the coin. There is also a hormonal aspect. Men who ejaculate frequently generally maintain a more stable hormonal balance of testosterone, estrogen, and other androgens. Maintaining this balance is critical, as hormonal imbalance adversely affects the prostate. Tissues lose their structure, and cells lose control over growth. This is when danger arises. An overloaded, inflamed, and hormonally imbalanced prostate is fertile ground for cancer. There is another little-known fact. The immune system functions most effectively with an active lifestyle, which also includes sexual activity. Orgasm triggers the release of substances that activate defensive cells responsible for recognizing and destroying faulty cells before they become a serious problem. Thus, maintaining sexual activity enhances immunity, making it more vigilant and ready to respond to any irregularities. We should not forget blood circulation either. During ejaculation, the muscles of the pelvic area contract powerfully, accompanied by increased blood flow and improved tissue oxygenation. As a result, tissues receive more nutrients, helping to reduce oxidative stress. This process, seemingly subtle, has a substantial impact on cellular health and becomes not just a pleasant sensation, but an important physiological function, a kind of anti-aging prevention. Ultimately, the male body is built to function, and the prostate is an integral part of that process. If you block this natural process for a long time, you act unwisely, accumulate risks, and what starts unnoticed often ends with a diagnosis. This brings us to a question that worries almost every man, usually asked in a quiet voice, with a hint of confusion in the eyes. Doctor, do you mean I need to ejaculate 21 times a month? It's a reasonable question. Many have heard this number from various sources, but let me clarify one key point. Health is not defined by a single magic metric. Yes, there was a study showing reduced cancer risk in men who had sex 21 times a month, but this should not become an obligation like taking medication on a schedule. Your body is a unique system. Every man has his own rhythm, past experiences, energy level, and life stage. Scientific data shows trends, not ready-made prescriptions. In fact, the most harmful thing is not failing to hit a certain number, but treating it as mandatory. What's truly unfavorable is when the body is allowed to stagnate and inflame, like a blocked mechanism designed for movement that we ignore. This is especially relevant for men who often live in a closed loop of silence, feeling disconnected from their bodies. So instead of fixating on how many ejaculations per month, we should listen to what our bodies ask of us, something we often ignore. If you have health, energy, and desire, there's no reason to suppress them. If you don't have a steady partner, or you think your age is not the right time, remember, the benefit your prostate derives depends on the gland itself, not on your appearance or whether you have a companion. Don't compare yourself to others, and don't let this become a source of guilt or pressure. Pay close attention to your body, and it will tell you what it needs. In this context, men, especially those who have undergone or are planning to undergo surgery, often ask me an important question filled with anxiety. How will prostate surgery affect my ejaculation? The answer depends on the type of surgery. If we were talking about benign prostatic hyperplasia, when the prostate enlarges and compresses the urethra, a common procedure is transurethral resection. It removes excess tissue from inside the gland, much like scooping the pulp from an orange while preserving the peel. Most often, this procedure resolves the problem of a weak or intermittent urine stream, which frequently causes nighttime awakenings. However, few know about one of its side effects, which is not dangerous but worth mentioning: so-called retrograde ejaculation. What does this mean? During orgasm, semen, instead of exiting normally, flows back into the bladder. It's important to note that this is not painful, does not affect the quality of orgasm, and does not impair erection. The orgasm is fully preserved. Only the semen does not emerge. Later, the semen is expelled with urine without any negative consequences. In more serious interventions, such as for cancer, when the entire prostate along with the seminal vesicles is removed, the situation changes. Fluid production stops, and a man retains the ability to feel pleasure. However, it will be a dry orgasm without ejaculation. Such an outcome may entail risks of erectile dysfunction or urinary incontinence because the nerve endings responsible for erection lie close to the prostate, and preserving them during surgery is not always possible. It's a difficult decision requiring careful thought, courage, and, where possible, the use of modern technology such as robotic surgery, which increases precision and the chances of preserving function. But the most important thing I want to say to every patient who looks at me with worried eyes is this. Regardless of whether semen production continues or not, the main thing is to be alive, to keep living, to hug your grandchildren, walk by the sea, and smile at the family table. Life goes on, and we continue to live it with dignity. By now, you have realized there is no magic elixir, no miracle supplements, or herbs hidden in the Himalayas. The true defender of your prostate is your daily decisions. And yes, maintaining a healthy lifestyle, including cleanliness and ejaculation, is one of those decisions. But it does not work in isolation. If you smoke, quit now. Neither the prostate, nor the lungs, nor the heart forgive tobacco. Excess weight cannot be ignored because it represents a constant source of inflammation. If your diet is heavy in processed meats, red meat, and soda, it's time to rethink it. Your prostate will thank you when you increase vegetables, fruits, and fish on your menu and reduce ultra-processed foods. And if you're used to spending most of your day sitting, it's time to move more. 30 minutes of walking a day is not a panacea, but the minimum for preserving health. Above all, get examined. Overcome the internal barrier and approach procedures like digital rectal examination with due attention and understanding of their importance as simple, quick, but vital measures for your health. Take a PSA test and make an appointment with a urologist. Do not postpone a visit to a specialist until symptoms appear.